Servo-c has a whole new structure, and it's coherent throughout the system. So on a detail level, we have redesigned all the small controls and buttons, and we also reduced the number of different variants so that it's applied more consistently throughout the interface. And on a higher level, all the windows have been harmonized. So that means that there are fewer versions, and they always appear at the same area of the screen. So the device becomes more predictable and easy to learn. Our goal has always been to design ventilators that are easy to use. Something that is quick to learn and requires as little attention as possible from the clinicians, so that they can focus on their patients. And Servo-c does this better than any device that we've designed before. And we can't wait to get our users to try it out and feel the difference.